Ladies and gentlemen, good afternoon. It is my job today to present to you the spectacular achievement of Apollo Children's Hospital and also to present to you the people who were behind this particular success. The separation of thoraco-omphalophagus twins, Adriana and Abriana. Apollo Children's Hospital, of which we are very proud, is the first flagship hospital, a purely children's hospital of the Apollo Group, which is 100-bedded, multi-speciality, fully equipped, freestanding. And the biggest advantage we have is we are very close to the main hospital, and so we can always have more resources at our disposal. The story starts in Tanzania, like what it was for Ericana and Eludi, from the capital city of Dar es Salaam. Adriana and Abriana are lovely baby girls who are second born to Mr. Jimmy Temi and Caroline Zachariah. They have one child who's 3 years old, a male, and this child was born in a private hospital in Dar es Salaam by cesarean section because the babies were in a breech position and did not move. It was only after the babies were born did they realize that they were conjoined. They came to Apollo Children's Hospital, Chennai at 5 months of age. The term thoraco-omphalophagus means fixed at the chest and the abdomen. The term pagus means fixed. Thoracic refers to the chest. Omphalus refers to the abdomen, so they are fixed at the chest and the abdomen and they are facing each other. It's a common variety of conjoined twins, but there is a unique twist to Adriana and Abriana, which I will explain in the course of this presentation. The birth of conjoined twins is common in West Asia and Africa, the reason for which is still not clear. It's a rare event. It's about 1 in 100,000 births. Almost 35 to 40% of them die after birth. So which means to get a live pair of conjoined twins is a rare event. Caroline and Jimmy were told that their babies would not survive because they had a single heart. It was Dr. Rochita who picked out that there were 2 hearts with their apices touching each other. This very important finding was made by Dr. Rochita, that they have a liver bridge and a vessel going across. This is a millimeter by millimeter reconstruction of the CT images to give an idea to the surgeons of what they can expect when they go in. Again, she also predicted that the blood supply to the intestines would be completely separate based on the way the arteries and the veins were there. A further contribution that she did was to do a 3D reconstruction of the baby's spines, and she was the one who said Adriana has got a scoliosis, so she probably will require the services of an orthopedic surgeon much later in life. Based on the findings given by Dr. Rochita, a team was constituted which consisted of 4 anesthetists, 4 plastic surgeons, 2 cardiac surgeons, 3 liver surgeons, 2 pediatric surgeons to deal with the gastrointestinal tract, 3 pediatric intensive care specialists, and along with the junior doctors, this forms a 25-member team. The 4th step was the preparation for the separation. Because there is a large area of union, the skin had to be expanded. So the plastic surgeons got together and inserted what are called tissue expanders to increase the availability of skin for closure. Can I request the anesthetists please to come on to the stage? Dr. Anuradha Vasudevan, Dr. Sanjay Prabhu, Dr. Vasant Rupan, and Dr. Rajgopal. Giving anesthesia for conjoined twins is a particularly difficult task. Since they are joined and they are facing each other, some of the events that you need to know about anesthesia is we always take anesthesia for granted, but theirs is a very, very difficult task. First of all, with the babies facing each other, intubating them is very difficult because there's very little space that's available for you. Though there are 4 limbs, they are on different planes, so the amount of vascular access that you can get from the limbs is very limited. When you give drugs in one baby, the opposite baby gets affected. So when you are giving multiple infusions for a surgery of this magnitude, what happens is the effects on the 2 babies cannot be predicted, which means you have to monitor them every minute and you have to monitor multiple parameters. Then as the separation is going on, there is a huge amount of blood and fluid loss, and that has to be compensated. The babies have to be kept free of pain. So the success of the separation hinges to a very, very large extent on the anesthetist. The date for separation was fixed as the 17th of November. A detailed separation strategy was drawn up and finalized. Equipment was procured and supporting personnel were mobilized within 3 days. The OTs were prepared and sterilized, and most importantly, the parents were counseled by each team in detail. Could I call upon the liver team, please? Dr. Mahesh Gopasetti, Dr. Anand Ramamurthy, and Dr. Anand Kakar. Could I call upon the pediatric surgical team, Dr. R.K. Bagdi and Dr. Prakash Agarwal. We are very proud of these liver surgeons because they have one of the largest liver transplant experience in India.
The challenge that we faced in separating the liver was to identify what half of the liver belonged to which of the two twins. For that, we occluded the blood supply to one half of the liver. That liver became a little dark, and we knew that half of the liver belonged to that particular child. We were able to mark that ischemic plane, and that's us marking the plane which half belonged to which of the two kids. And other challenge was to separate the liver without losing too much blood. About 30 to 40% of the total body's blood flows through this liver every minute. So we utilized this ultrasonic dissector and we separated the livers carefully. You can see that the two livers are separate. You can see that the intestines are separate for the two twins. There was no cross connection between the two intestines.
Could I call upon Dr. Neville Solomon and Dr. Ganapathy Subramaniam to come on to the stage? Ladies and gentlemen, for us, we are very proud of this cardiac surgery team. They consistently take up very big challenges in cardiac surgery and produce superb results. Most of all, through the Save a Child's Heart initiative, they have benefited innumerable number of children who can't afford care. So this is a great achievement of theirs. It is my privilege to call Dr. Neville Solomon to tell us how they went about with the cardiac separation.
We were really excited when we heard that the conjoined twins were coming over, and my first concern was whether the two hearts would be joined together. Each heart consists of 4 chambers, and at times you have to play God and decide which twin survives. So one twin gets 4 chambers and the other just 3 and can't make it. And the second thing is they can be born with associated congenital lesions of the heart. So the most delightful thing here was that the hearts were separate, and then we had the chance of separating the hearts. The only thing is the pericardium was common. The sac in which the two hearts lie was shared, and in one of the twins, Adriana, the heart was poking out. So it's not a simple option like you have a suitcase full of clothes and you jump up and down and cram your clothes in. You can't do that to the heart. So we have to be very careful because we can tamponade the heart. So in Abriana's case, it was very simple. We were able to cover the heart with the pericardium, and then we could achieve skin soft tissue closure. In the case of Adriana, we had to stitch a layer of bovine pericardium on the heart, so the heart is covered, and then we had to deal with the gap and the heart was poking out. Fortunately, we were able to just adjust it a bit and it went under the sternum. Then we were ably supported by an excellent plastic surgical team. So they gave me the confidence that we could achieve cover. The only interesting thing is in Abriana's case, the heart's facing to the left, and in the case of Adriana, the heart's facing to the right. They're both covered by their intact breastbone, so that should not be a problem in the long term. Thank you.
You saw the angle at which the separation was going on. So there's one pericardial cavity, 2 hearts which are beating side by side, each one poking into the other child's body. So that's a very unique thing, and I'll explain that a little more. Then we come to the very important situation where we have separated the babies. The babies have moved apart to 2 theaters, and we have the plastics. Now we rely upon the plastics team to provide closure for us. Could I call upon Dr. Shivakumar, Dr. Ganapathy Krishnan, Dr. Roshni Gopinathan, and Dr. Leela Praveen Kumar were the plastic surgeons who did the closure of the babies. Could I call upon Dr. Ganapathy Krishnan to tell us how they went about closing these babies?
As far as the challenge for the plastic surgeon goes, it was basically to give them a good skin cover. Now, irrespective of what happens inside, whatever you would separate it, ultimately you need to have a proper cover so that there is no possibility of infection and things going in. Now, if you look at these 2 children, they were actually, as I said, were joined at this area. But we thought that once they are separated, especially with the liver almost crossing the midline and going on to the other side, we thought that there would be a problem then closing it. So we actually did what is known as a tissue expander. So what you see, those two swellings there are basically what are called as tissue expanders. They are nothing but sort of silicone balloons which are inserted into the skin, under the skin. We did this almost about 1.5 months earlier to the planned surgery. So once we put in these expanders inside, we actually keep injecting saline into them maybe once in 3 days or 4 days. And as the expanders balloon out, it's basically like a balloon. As the balloon becomes bigger, the skin over the balloon also stretches. So this gives us that extra leverage that in case we had a problem on surgery of not able to close it, the stretched skin would be able to possibly get us a good closure. So this is what we did prior to the surgery. So once we injected the saline, they were ready, and when we thought that yes, it was ready, we took it up for the separation. And at the time of separation, this is the picture that you see. The liver has been separated. The liver has been separated. That's the heart there, the intestines there. Now we need to cover this. I mean, initially it looks quite a challenge. You have such a big open wound there. So what we need to do is this is the gap that the balloons were kept on either, one on each baby. So we had to actually raise up the skin as much as possible so that we could free the skin and get it to cover the organ. So that's the picture. We start closing from below. These are some of the internal layers of the abdomen. Once we close this, now we find that only the liver and the heart is exposed. And finally, over that, we got the skin to be covered.
So this is the jubilant surgical team after the separation was done. So it took 7.5 hours for the separation and 3.5 hours for the closure by 2 teams. So that's a total of 11 hours that we took. The post-operative care is the most important, and we have a superb team of pediatric intensive care specialists. Could I call upon Dr. Suchitra Ranjit, Dr. Indra Jayakumar, and Dr. Satish Kumar to come over to the dais. The pediatric intensive care team in this hospital was instrumental in this hospital being set up in the first place, and the pediatric intensive care team is perhaps the best, I would say, in the country. I would request Dr. Suchitra Ranjit to come and explain to us the management of these children in the post-operative period.
Thank you, Dr. Sripathi, and good afternoon to our wonderful chairman and executive chairman, chairperson, and Dr. Bama, members of the press, all our friends. We feel so privileged to be part of this major surgery. We've heard of all the surgical details, and at the end of 11 hours of a grueling surgery and many months, many weeks of planning, both the babies were finally deposited in the pediatric ICU under our care. And it was our brief to make sure that they went home well, they were protected from infections, and they got the care that they deserved. And our team suddenly had to look after not just 2 PICUs in the hospital, but one more. And the junior doctors and the nurses rose wonderfully to the challenge. So we had to make sure that both babies cared by 2 teams with not much intermingling. So there was a blue team and the pink team, color-coded their sheets and their dresses to make sure there's no interchanging of staff. I'll start with Adriana. She did very reasonably well and things were very smooth, but she was very grumpy. She was thought to have acute separation syndrome, where she's been conjoined with her twin all her life and suddenly she's separated. So her father showed her pictures of a twin, and she was shown some mirrors to make it seem as though she's looking at a twin. I'll show you a picture of that. So that wasn't too bad. But here you can see that she's looking into a mirror, and that's the time she started smiling at people because she thought her twin is right in front of her. Adriana, after about 6 days of smooth sailing, suddenly there was major problems. She was critically unwell because her heart took up residence on the right side of the chest for some inexplicable reason. There was a large fluid collection on the right side, and that was sorted out. Dr. Rochita helped us with an emergency CT scan. The entire team landed up on a Sunday morning, so that was amazing. We had everybody's brains sorting out what could be happening. And as if that wasn't enough, the very next day, her intestines became very adventurous and slid out through the small gap in her abdominal muscles, spread out over the entire abdomen, and then slipped up further and went up over her chest, just where her heart lay exposed under just one layer of skin. So that was another emergency, completely unanticipated, and the surgeons were completely up to it, the anesthesiologists. Before we knew, by the time Rochita gave us a result, she was posted, and this large mesh was put in. Her abdomen was opened again. This mesh covered the exposed intestines, and the chest was closed once more. So I must say that we got so much input so fast, I think, because it was done at Apollo Children's Hospital. So another unique facet of the entire effort was this very unique kind of WhatsApp updates and planning. So it was minute by minute, every member of the team knew what was happening to fever. Every concern was discussed by consensus and decisions were taken. So that made the entire process so smooth.
This particular separation is a unique achievement. Since 2007, 8 Omphalopagus twins have been reported in India after separation. That is, they were mainly joined at the liver and the intestine. So there were 2 in 2007, 2 in 2012, 1 in 2013, and before us, 3 in 2014. But there was only one other Thoraco-Omphalopagus in this group, and this was in 2012. Children called Aradhana and Stuti, who were separated in a district hospital by the name of Betul in Madhya Pradesh by a team which flew from Sydney. The separation was successful, but Aradhana died suddenly 3 weeks after separation, presumably from a heart attack. So the importance of what Neville Solomon said earlier, that you really can't treat the heart like you treat any other organ and try and confine it to a particular space, we don't really know that might be the cause. Whatever it is, Adriana and Abriana are the only Thoraco-Omphalopagus twins surviving after separation in India, and that's the unique achievement of Apollo Children's Hospital. We will not be doing justice unless we acknowledge all the people who have been involved in this. Dr. Annie Marthandam, our MC today, the laboratory services and the blood bank, very quick with her reports. Infectious diseases, Dr. Ram Gopalakrishnan and Dr. Suresh, always making sure that we do not get infection. Crisis support, the pediatric endocrinologist. The last time we had a separation, we had a problem with hormonal fluctuations in the babies, and Dr. Anberil made sure that it didn't happen this time. What Dr. Suchitra was saying about ensuring that the drainage in the chest was drained, that was the work of the interventional radiologist Dr. Satish. Dr. Shashank, thoracic surgeon, came, gave us an opinion on whether the chest had to be opened. And Dr. Balaji is a very good friend of ours. Whenever we are handling any complex situation, he comes, sits outside the theater. He sat for 11 hours outside the theater saying, I'm here anytime you need me, I'm willing to help you. And we are grateful for that. The heroes in the background, I have just put the names of the nurses in charge, Sister Salome, Sister Pushpa, and Sister Sripriya, who managed to get a wonderful team of nurses to come together to help us. The OT technicians, our chief technician, Mr. James, and Mrs. Bhagya, who did a wonderful job in the theater. Our OT housekeeping, Mr. Sashi, who made sure that all the linen was correct. Our security officer, Mr. Ratnam, our catering manager, Mr. Durai Chaudhary, and of course our senior dietitian, Mrs. Lekha. But we will be failing unless we acknowledge the management, the ACH team of Dr. Seema Pandey, Mrs. Anita, Sri Priya, and Dr. Bharat. Of course, the Director of Medical Services, Dr. Bama. We get our inspiration from the chairman. If the chairman were to say something, I'm sure he will say it now. He'll say 2 twins are not enough. Do 20 and then talk to me. And that is the never die spirit that keeps us going. And here are the babies who are wishing you goodbye, Adriana and Abriana, as they are ready to fly away. And once again, thank you very much.
I don't know how many of you know the song, but there is a song which says, I believe in miracles. And I truly do believe in it. Because, I was sitting with chairman, and when we did this hospital, it was literally, according to chairman, not a very nice facility. He's very nice, he never says negative things, but I think his mind thought it was a dump yard. It was that bad as a building. But anyway, we didn't have any other space, and my sister had taken it as a go down, and she very kindly said, okay, fine, since you're asking, okay, take it. And I really never thought that miracles would happen in this building. So for that, I think I must really thank the entire medical team for believing in miracles and making it happen. So thank you all for being part of this family. For the families of these children, for them to trust us and believe in us, I think is a great thing. It's not easy for someone who's halfway across the world to really believe in the Apollo way, as Dr. Sripathi said, come so far and, allow us to even attempt to do something so heroic with their children. We have to thank the parents for that, and I think that also is a miracle. But having said that, I really think that the whole Apollo story, which started in 1983, happened because of just the faith Chairman had in the team, and definitely with a lot of prayers. So I think the whole Apollo story, to me, seeing this today itself is a miracle. So forgive me if I'm saying that I believe in miracles. I think I'll continue to do that. And I have also learned from Chairman that life is priceless. And for those of us who don't realize that, I think end of the year, beginning of a fantastic new year, it's time to say that life is priceless and we will continue to contribute back to society. So for to you and your families, have a fantastic year ahead. And 2 is not enough. There's just so much more we have to do. The twins, healing hearts, going out and saving lives, the intensive care, pediatric intensive care itself is like a huge challenge. So there's lots to do, and I think this is just a small beginning, and I hope we can do so much more in the future. And I was saving the big thank you for the end is for our friends from the media. When we started, you all supported us, you trusted us, you had faith in us, and if Apollo is what it is today, you also played a large role in that. So I'd like to thank you all for it. Wish you good health in the new year, because unless you're all healthy, I don't know if we can continue doing the good work we are doing. So for our friends from the media, take care of your health also. And thanks for being part of the Apollo family now and always. Thank you.
Namaste. What a delight, huh? If you're looking at all of these doctors, they'll say, it's not that we have done extraordinary things. We brought that extraordinary strength that is within all of us, but did it together. I think the biggest thing that we learned from day one at Apollo was, yes, as an individual, we are par excellence. But when we combine our strengths, there's nothing that we cannot do. We have shown it repeatedly. Many times they have asked. Here and over again, when I go to US or UK, they say, how come, Dr. Reddy, your teams are doing this so easily with outstanding outcomes and at a fraction of the cost? Now look at this liver team. They did all this. They became world number 1 in heart, kidney, and liver transplants, and did those numbers, and then with an outstanding outcomes, and still the price costs were 10% of the international cost. Today, when we began, our vision was very clear that we will give our people the same level of care that's available for people anywhere in the world. We not only did that, we saw to it that no Indian need to go abroad, but then we are getting patients from over 150 countries. But these numbers are not small, but these numbers are, what they are coming is going to be tremendously more, because they have now developed greater and greater trust. See, from the same country, to get the second set of twins in 1 year, and they're going back, is what a joy for them, and what a credibility for the country. Now, this is what I told our External Affairs Minister. When medical tourists come to India, they bring you $2,000. When medical tourists come, they spend $20,000. But more than that money, they take back and take the pride of our country to their country. This is the biggest gift that Apollo and other all healthcare facilities are doing by treating patients from overseas and giving them the care that they probably would have never got unless they go to the very best institutions anywhere in the world. And I'm happy to say that Apollo is one of those world's best institutions which are doing outstanding care. You know, quite recently, our Prime Minister went to Australia and then went to Fiji. At that time, Sangeeta, our managing JMD, was in Fiji because we got a clinic there. You all know that we were the first to start in the world as satellite telemedicine. We have over 50 international telemedicine centers. She was there at the telemedicine center and the clinic, and the Prime Minister said, "Oh, here is Dr. Reddy's daughter." And then he asked her, "Why are you here?" He said, "No, we are doing a lot of work with giving telemedicine and advice for people, and the patients come to India for this." So he on the spot declared that all the 14 island people will get visa on arrival. So I think there is that interest in the Prime Minister and in the government saying that we need to tell the world that out in India, we can give the same level of care as any best center can do, and then probably also give it at a very, very low cost. This is, I think, to be able to give outstanding care. I was amazed, as I saw each of these doctors and the doctors' teams that how they diagnose and then how they planned the whole thing meticulously and worked as a team. Hearty congrats to all of you. I think it's not here. I think the world should know that you are a great team and a team which will do their work and do that work extraordinarily well. And then have the great coordination between each and one of you. And I have no ordinary words than to say you are truly wonderful people. God bless you. I think it's not just the doctors. They've also acknowledged, they right up to the security person had made a very significant contribution. To all of them, my hearty congratulations. Let's give them a big clap. See, I think there's a very clear message that India can now proudly give to the rest of the world, saying out in India, previously when we first started healthcare in India, they said, Indian doctors no doubt are far excellent, but the hospitals, how about infection? How about their post-operative care? I think we have erased all of those misguided thoughts that people had around the world. Out in India today, you saw their post-operative care is probably better than the best. I don't think anywhere in the world the two teams of nurses would have had two sets of dresses, so that meticulously they will get 100% post-operative care without infection. So I think some of it is your innovation. I think ultimately all the innovations that they have done in everything that we have done in Apollo from day one, 1983, and what our MD said, the Apollo way, is truly remarkable, which makes us feel happy. The happiness is when you see those children, when you see their parents. I still, a few days back I walked here, there was a child who was brought from Bangkok with fits, totally unconscious. When the child was taken home, I just saw a note from the mother. She wrote almost 14 pages of notes saying what an extraordinary people are there in this pediatric hospital who made a difference not only for the child, to take the child alive, the way they looked after the parents. So I think for each one of these, I think we must say, thank you, Apollo. But more than anything else, I think we are now ready to give it to the rest of the world, the care that they can get anywhere in the world, out here. And Chennai should be proud because many things, it all started here. But everywhere it's happening. Yesterday I was in Bangalore. They had a press conference because in less than a year, that one surgeon did 1,000 knee surgeries with outstanding results. So I think this is what's happening. In each field, each of our hospitals are now gathering greater strength and then coordinating with each other so that we can make India be able to deliver the world's best care, not only for our people, for the people of the world. Congrats again. God bless all of you. I love you all. This is a tremendous thing.
Good afternoon to everybody present here. It gives me immense pleasure in proposing the vote of thanks on this accomplished day, which has made a difference in a family, and we hope to make many more such potential differences in the lives of many. This achievement has been possible only because of the able leadership and guidance of our honorable chairman, who's been a constant source of inspiration and strength to our team of Apollo Children's Hospital. The team that worked together in perfect symphony, day and night, to make this endeavor an exemplary teamwork. Words fall short when I thank our beloved chairman from the bottom of my heart for being a force divine behind us, constantly making us achieve this again and again. Our strong, supporting, and very understanding vice chairperson has been there, giving us the right motivation and enthusiasm, which always makes us achieve excellence in medical and clinical pathways.